Okay, hi everyone. So we're gonna get started. So my name is Emma, and I'm one of the Green Meds coordinators here with Fiona. And we are from U of T's Green Meds team. And so for this seminar series, we've partnered with a lot of really great organizations and teams. We've partnered with Cascades, CAPE, Kane, and CFMS Heart to create a Canada-wide speaker series that addresses climate change and its impact on health and our healthcare system.
So the goal of this series is to introduce students to the impact of climate change on health and health equity, what it means for healthcare, and how we can advocate and promote a more resilient and sustainable health system in a low carbon world.
So just to give you a little bit of an idea about the session overview, so the speaker series is going to consist of 6 sessions total. They'll be about an hour each. And you do have the option of getting a certificate of completion as long as you attend 4 out of the 6 sessions and write a brief reflection, and that'll be available at the end of the seminar series. And we'll have more details around that towards the end.
So today we're lucky to have these two wonderful speakers here. So our first speaker is Sherilee Harper. And so Sherilee Harper is a Canada Research Chair in Climate Change and Health and an Associate Professor in the School of Public Health at the University of Alberta. She was a lead author on the Intergovernmental Panel on Climate Change, the IPCC Special Report on the Ocean and Cryosphere in a Changing Climate, lead author on the IPCC's 6th assessment report that was recently released, and served on the Gender Task Group for the IPCC. And whenever you're ready, Sherilee, you can start screen sharing and begin your presentation.
All right, great. Let's see. All right, so thanks so much for the invitation to speak today. It's a real pleasure and honor to be able to talk about climate change and health, and I'm really excited for the discussion that we can have afterwards. So today I've been tasked with providing an overview of climate change and health to sort of set the stage for the next presentation and for other presentations in this series. So let's dig into it. Especially this past week, climate change has been in the media a lot, and it continues to be in the media a lot, even when there's lots of other really pressing things happening in the world. It seems that climate change is continually a hot topic and something that people are caring about and talking about. So I just pulled a couple of headlines this morning, including the UN report that what they're calling the Atlas of Human Suffering. There was an article looking at climate change increasing the risks among forest firefighters, a piece on climate change and the need for climate doctors. There was an article in The Guardian that was looking at different things we can do to help combat the climate crisis, and lots of stuff lately on mental health. So climate change is definitely a hot topic and increasingly in the media. But how exactly is the climate changing? So this past week, the Working Group 2 IPCC report was published, and that basically looks at what the climate change impacts are. But this past August, the Working Group 1 report was released, and that focuses on how exactly the climate is changing. So I wanted to share a couple of those results from that August report, because I think it lays some important groundwork, and they definitely had some really new and exciting findings that I think are good to highlight. So this is something that we've known for a while, that warming is caused by humans. And before, the IPCC would say things like most of the warming is caused by humans. But now what they're saying is that virtually all the warming that we've seen to date is due to human anthropogenic causes. And you can see that in the graph here. If it was only due, or if there was anything to do with the natural warming from things like volcanic eruptions or things like that, we would see this bottom curve. But this is what we're actually seeing. And so now we are virtually certain that the warming has been caused by humans. The second key finding from the report in August, basically it looked at different degrees or levels of warming, and this is because of the Paris Agreement. So the Paris Agreement is this international agreement that we want to keep warming to 1.5 if possible, but at least well below 2 degrees. And so what they did is, for soil moisture, precipitation, and temperature, they showed what a 1.5 degree warming world would look like, a 2 degree warming world would look like, and a 4-degree warming world would look like. And they also highlight that these have different, the global warming has different regional impacts, as you can see in these maps here. And they also documented that we've already experienced 1.1 degrees of global warming, and we're already seeing the impacts that we've seen over this past year, for example. So, this clearly shows that we're on the path to see more of those. And that was actually a really important finding of this report that was released last year. For the first time, they were able to really delve into the attribution of these extreme events in a lot of detail. So here's one example that looks at how global warming can increase the frequency and intensity of extreme events, using temperature extremes as an example. So you can see here that like what used to happen once a year is now happening, five times more likely. Let me step back. So the first panel here you see is an event that used to happen once every 10 years, and the second panel is an event that you used to see happen once every 50 years. And this type of thing is important because it's used in things like building codes and infrastructure codes. So this type of metric is important. So it used to happen only once every 10 years or once every 50 years. It's now happening 3 times every 10 years or about 5 times every 50 years. And you can see that under future warming scenarios that, will increase. And if we hit 4 degrees of global warming, which is the trajectory we're on right now, we'll see that events that used to happen once every 10 years will happen about once every year. And events that used to happen once every 50 years will occur almost once per year, which is a substantial increase. So things like the heat dome that we saw last summer, that would have been virtually impossible to have experienced without global warming, and just shows the increase in the magnitude of warming that we could see in heat waves in the future. The other new thing that the IPCC Working Group 1 did is they integrated what are called shared socioeconomic pathways into their scenarios. So, for temperature, for Arctic sea ice area, and for sea level rise, the classic IPCC graphs are still the same, where they show what we've experienced so far and what we've seen in terms of past warming to date. And then the second half of the graph is what our future could look like. And this is one of the jobs of the IPCC, is to not to show a prediction of what our future is going to look like exactly, but the range of futures that we could look at. And before, they used to be only based on emissions and our level of emissions. But now Working Group 1 has also integrated things like population growth, development, sustainability, and these other metrics into their models under these shared socioeconomic pathways. And you can see those illustrated here. So how does that impact society or our health? Well, it impacts our health in so many different ways, because all of these things impact the air that we breathe, the food we eat, the water we drink, and all of those things impact our health. But I wanted to go through 4 specific examples today, and with a little bit of research behind those. So let's start with heat waves. We had the heat dome this past summer, so we can especially if you were in Western Canada, but this was experienced throughout all of Canada, this massive heat wave that went through North America. So in British Columbia specifically, there were almost 600 deaths, and there were 231 deaths on June 29th alone. And there are increasing studies that are coming out. There's been a couple now that have looked at the mental health impacts of that heat wave. So one study looked at climate change anxiety levels and found that after that heat dome went through, anxiety increased by about 13%, and 40% of participants reported that they were much more worried now about climate change after experiencing the heat dome. And there have been studies, especially in the United States and in European countries, that look at hospital admissions for different mental health challenges. And there are statistically significant associations that show that during heat wave events, there are significantly more hospital admissions for mental health concerns during times of heat waves than when there are not. So typically when people think about heat waves, they think most immediately about things like heat stress and mortality related to things like dehydration, but there are also other ways that heat impacts our health. We know that heat plans are really critical. And a critical part of heat plans are early warning systems. So a health jurisdiction will have a heat plan, and when temperatures are predicted or forecast, I should say, to be, that we're expecting a heat wave, then this mobilizes a whole bunch of different resources, public health resources. It also lets people know that it's coming so that they can prepare and be aware of it, check in on neighbors, be prepared if they're working outdoors to adjust the type of work they're doing or whether or not they're even actually able to work outside. But a key question in research lately is, are these effective? We know heat plans are effective, but what about the early warning system component? There was a study that came out just last year in the United States that showed that actually heat warnings aren't associated with a lower risk of mortality. And heat warnings are also, at the same time, they are associated with increased risk of hospitalization. So people are coming into the hospital more, maybe because they're more aware, they're looking at for certain signs and symptoms, but it didn't actually lower the risk of mortality. And so this really, the question is, well, why is that? We thought that early warning systems were incredibly effective. That's often touted as the thing we need to do to adapt to climate change and to protect health. I think the answer is complex. And one important thing is that context matters. And there's really a lack of research that shows, what temperature level should be the threshold to trigger these types of early warning systems. Because it depends on the local infrastructure, it depends on the health resources that are available, it depends on the socioeconomic patterns within that city or that location. And picking one temperature threshold, it might be appropriate in one place, but it might be less appropriate in the other. And then I just want to highlight that these early warning systems are only one part of heat plans, and the heat plan overall takes a lot of other things into consideration too, like opening cooling centers where people can go and cool down, handing out water, public service announcements to check in on your neighbors and make sure people are doing okay. Different places have different rules in terms of if the temperature hits a certain temperature, that outdoor work is not allowed anymore, and so on. So in the context of climate change, we know that heat waves have increased in the past, and we know that heat waves have already impacted health. And we also know that it's projected to increase in the future. So here's one study from the United States that looks at under high emissions and low emissions scenarios, what this might look like. So here you see under a low emissions scenario by around 2040, we'll definitely see an increase of these types of events. And under a high emissions scenario by 2050 or by 2040, we'll see that there's going to be about double. So there will be more, but there's not that much of an increase. But if we look towards mid-century, we can see that gap starts to widen. So under a low emission scenario, again, even if we meet the 1.5 degree targets and it really reduce our emissions, we're still going to see more heat waves and extreme heat events come through. But look at how much more we will experience under a high emission scenario. And then if you look by the end of the century, well, that increase is just astronomically higher. And that starts to really worry people, because that's when there are serious concerns about our healthcare capacity becoming overwhelmed, especially during these types of events. And things like livability in certain places or habitability comes into question. Another area that is definitely a topic of concern, especially in British Columbia and Alberta, but elsewhere in Canada and the world, is wildfires. And I'm sure in the news, you've seen some of the wildfires that have ripped through California recently and had really devastating impacts on infrastructure, but also on people's health. And, it impacts people's health in a number of different ways. And studies have associated the increase in wildfire smoke with things like increased death, increased emergency room visits, PTSD, skin burns, heart issues, poor water quality and water supply, which has cascading impacts on a number of different health outcomes, and of course, respiratory problems. And the research shows us that we know that fire activity has increased over the past 2 decades. And in Canada and in the United States specifically, we have seen an increase in fire occurrence, the area burned, and the number of ignitions. And in Canada, there's really strong research that attributes this specifically to climate change. And then in the United States, about half of the increase in the annual area burned in American forest fires is attributed to climate change. So there's a clear climate change signature or fingerprint in these events. Another area is food, and of course, food impacts our health in a number of different ways, including nutrition. But there's some solid research on foodborne disease coming from Canada specifically. So I wanted to look at that quickly. We know that outbreaks of foodborne disease are associated with things like temperature, atmospheric temperature. They can also be associated with things like rainfall or extreme rain events. But in coastal areas, it's also associated with ocean warming. And we know that ocean warming is projected to continue to increase. We're locked into a certain level of warming there. But we also know that adaptation efforts are really, really critical. So for example, this is a study that was done by the Public Health Agency of Canada that looked at oysters and paralytic shellfish poisoning. And they found that this outbreaks due to this are projected to increase into the future, but they looked at it under two different scenarios. And of course, not surprisingly, you would expect to see more outbreaks happen under high emission scenarios versus low emission scenarios. But they also looked at, what adaptation strategies are effective at trying to reduce those number of outbreaks or those number of infections. And they found that some of the most promising options are doing things like increasing surveillance and monitoring of both the oysters themselves and of people when they get sick, but also introducing more regulations in terms of like temperature control of the oysters themselves, keeping them cooler longer to keep them safer. But what was really interesting is that they found under a high emission scenario that the efficacy of these adaptation strategies decreases. So under higher levels of warming, adaptation strategies become less and less effective, and we're less able to effectively protect public health. The fourth area that I wanted to touch on today was mental health, and this is definitely a hot topic of research, and it has been a really key finding actually of the IPCC report that was just released last week. This is the first time that the IPCC has actually fully assessed climate change impacts on mental health. So this was a really key advancement in this most recent report that was just published last week, which looks at overall, how does climate change impact our life? Climate change impacts mental health through three main different ways. So one is directly impacting mental health. So for instance, if you're in an area that's experiencing wildfires and you need to be evacuated, that's obviously incredibly stressful and is associated with things like increased PTSD, but it can also climate change can indirectly impact our mental health. So for example, if you have a livelihood, like a farming or a fishing livelihood, and that's being impacted by climate change, if you have a crop that fails, or if it's impacting your livelihood in some sort of way, then climate change can indirectly impact mental health. And it can also, the third way is we can vicariously experience climate change impacts through the eyes of other people, and that can create mental health challenges. So for example, for me living in Alberta, watching some of the flooding this past summer that happened in British Columbia, and watching the infrastructure damage, the devastation to the landscapes and how it was impacting people, and seeing those images constantly can definitely increase stress and worry and anxiety related to climate change through vicariously and experiencing it through other people, or knowing people who have had to experience some of those extreme events. So those are just 4 examples, but there are a lot more for sure. It impacts pretty much every facet of health. And it doesn't matter what health outcome you look at, you can see that these health impacts have already increased over the past couple of decades, and the research shows that. And the research also shows that when we look under different projections looking into the future, that even if we drastically reduce our emissions, we meet the 1.5 degree Paris Agreement targets, we know that health impacts will continue to increase. But we also know that there are effective adaptation strategies that are also feasible that can help protect health. But if we continue on with business as usual and we exceed 2 degrees global warming, we know that the health impacts will astronomically increase. And that's when there's worry about limits to adaptation and concern that our health system will be overrun. I just wanted to put in one comment about how these things are talked about and discussed in international decision-making arenas. And one of them is through the United Nations climate change COPs. So each year there's a climate change COP. That's where the Paris Agreement was struck. That's where other things like the Kyoto Protocol and other agreements have been struck. It's where every year the UN member states come together to negotiate climate change and to talk about progress. And last year at COP26 in Glasgow was the first time that there was a health pavilion at COP, which was really exciting to see because that means that decision makers at an international scale are starting to think about how climate change is impacting health and how they can better integrate health into their decision-making processes at a national and international scale. So I think that it's a very exciting time in terms of public health and healthcare practice to start thinking about climate change and discussing climate change because people are really starting to understand the extent to which climate change could impact our health. So with that, I will stop there and thank you. And yeah, I'll turn it back over to our facilitators.
Thank you so much, Sherilee, for your presentation. That was really interesting. And also, we forgot to say this earlier, but if the audience has any questions, please just submit them through the Q&A function. You can submit them anytime, and then you can also ask anonymously. But we will ask those to our speakers during the discussion period after the next talk, which will be done by Fiona Miller. So Fiona is a professor of health policy in the Institute of Health Policy, Management and Evaluation at the Dalla Lana School of Public Health at the University of Toronto. She holds the chair in health management strategies and is a Connaught Scholar. Fiona directs the Centre for Sustainable Health Systems at the University of Toronto and a national initiative for climate action and awareness in healthcare called Cascades. In these roles, she leads and supports efforts to improve the sustainability of health systems through research, education, practice change, and policy advocacy. As a policy scholar, Dr. Miller brings a critical political economy perspective to the analysis of technical innovation and sustainability transitions. Her work aims at sustainable demand-driven innovation. Whenever you're ready, Fiona, you can go ahead.
Great. Thanks so much. I trust you can hear me. Thanks very much for having us and for organizing this. We've been working very happily with UT Med's leaders, Fiona and Emma, to put this session together, and I want to thank Sherilee for giving a terrific start to this. So I can pick up from this. I just want to acknowledge that I'm speaking to you from the University of Toronto, and these lands for thousands of years have been the traditional territory of the Huron-Wendat, the Seneca, and more recently the Mississaugas of the Credit River. And I'm very privileged to both work and indeed live on these lands. So I want to ask and try to answer the question, why health systems, by which I mean organized efforts to support health, dignity, independence, well-being, particularly through healthcare, related social care interventions, and critically, the interconnections with public health systems. So these are organized efforts. Many things support health, as you know, but we have very organized efforts to do so. So why are health systems an important part and parcel of this? And Sherilee started to really clearly answer that question. I want to take it another kind of steps forward. And as already been indicated, the first, I think, reason that requires and in many ways forces those of us who think about how to deliver, organize, plan, govern these organized services and systems is the challenge of adaptation. So as we know, these are images from British Columbia, from my colleague, Dr. Andrea McNeil, surgical oncologist at Vancouver Coastal, director of the Planetary Healthcare Lab and member of the Cascades Executive, the heat dome, the wildfires, the atmospheric river later, creating the flooding. These challenge the capacity to deliver care as well as increasing demands for care. In Vancouver, all of the surgeries were canceled because of the enormous uptick in heat-related illnesses. And so in this recent report that just came out of Health Canada that Sherilee helped motivate and get written, there is a fabulous chapter on health system adaptation and resilience. And so this is just a smattering of examples of challenges to organized capacity to deliver care, whether it's because of heat and humidity that requires an operating theater to be closed, or a hospital that needs to evacuate patients, or in fact loses power because of an ice storm. These are challenges to operations, challenges to patients' ability to get access to life-saving treatments, to dialysis, to get their medications. All of these things are threats to the capacity to operate, even as the demand for care, often concurrently in the context of these climate related weather extremes and events, create significant challenges for healthcare. And the image here, these are all about sort of events that happen locally. And that is where we experience the challenge of climate change. But the threat to the capacity of healthcare in particular and social care to continue to operate is also because these kind of events can happen anywhere in the world and threaten the resources, the supplies that we require. The manufacturing of them or their transportation around the world can be challenged by climate events that happen anywhere. So these are all the kinds of risks to operation. And then those health challenges that Sherilee has started to talk about implicate healthcare professionals and social care professionals in the work that they do and must do. So here's just a smattering of examples focusing on the challenge of extreme heat, which we know is with us and increasing. So if you are in community care, i.e. you would do Meals on Wheels or conjugate dining or respite care, all the kinds of important forms of support for people with disabilities, aged and infirm individuals. There are needs to adapt one's practice in the context of heat emergencies to check on individuals, particularly those who may be poorly housed, who don't have air conditioning, whose food or medications are not well maintained or preserved. If you work in acute care, then what are the things that you need to think about in the emergency room or when there is a discharge plan in the context of extreme events? If you are a pharmacist, what are the challenges for medication, safe handling of medications in the context of heat? Things like insulin is not very heat stable. A number of commonly prescribed medications reduce thermoregulation, and so individuals who are taking them are at greater risk. So there's all sorts of issues, whether one is at the front lines of delivering care or is an organizer, planner of services or of our supply chains. Climate change and the challenges that it brings will require that health systems become more resilient. And so quite a bit of work has been done, both in Health Canada, where we have global leaders doing this kind of work, and through the World Health Organization to think about and provide guidance for what it will mean to build a climate resilient health system. So that, I think, is the first answer to the question: why must organized systems of care and related services be actively engaged in thinking about and acting on climate change? It's the challenge of adaptation. To me, the second, and to many of us, the second challenge, which is a step up in a sense, because it's not as imperative, it's not forced upon us, but it is potentially a moral obligation, and that is the opportunity and challenge of mitigation, and that is to reduce the climate and other environmental harms of care, because healthcare in particular, which is the most environmentally damaging part of health systems, social care far less, public health far less. It's really health care, medicines, technologies, medical technologies, the facilities and services we provide is actually quite a climate intensive service sector, one of the most environmentally impactful service sectors around. And taken together, the healthcare sectors of the world would be the 5th largest emitter if it was a country and comprise almost 5% of global emissions. In Canada, it's estimated healthcare to be about 4.6% of national greenhouse gas emissions. So around the world, we're seeing increased effort to mobilize on this issue for healthcare providers, but also health services and systems to become more active in attempting to decarbonize. So quite recently, really only last year, we've seen very organized efforts at the national level, the federal level in the US to mobilize this health sector. So as of September of last year, under the auspices of the National Academy of Medicine, we saw the launch of the Action Collaborative on decarbonizing the US health sector. Within the Department of Health and Human Services, there is a new Office of Climate Equity and Climate Change and Health Equity, which has this twofold focus: one, on building resilience, and two, on low carbon sustainable health systems. There are, of course, individual health systems like Kaiser or Providence, which is a Catholic health system servicing many Americans in the West and North, that has the most ambitious climate action plan to get to actually climate positive, net positive by 2030. So very, very ambitious. If we look across the pond to the United Kingdom, that's where we see national ambition that's a bit more analogous to what needs to happen in Canada. These are national health systems. As you know, the UK has devolved. There are 4 countries of the United Kingdom: Scotland, Wales, England, and Northern Ireland. And that healthcare is a devolved responsibility. But the English National Health Service is the first national health service in the world to commit, as it did in October of 2020, to deliver a net zero national health service, to reduce climate emissions of care as close to zero as possible, and some small residual offsets then required. And though the ambition in Scotland and Wales is not as strong, nonetheless, we are seeing very clear national plans. We haven't yet seen this in Canada, although I'll get to that. Certainly some of the provinces, I think Quebec, British Columbia, are moving more aggressively. So when I talk about the climate impact of care, people typically assume that the reason for this is because of hospitals, because these are big buildings. They're on 24/7. They have huge air handling requirements. And it is true that the acute care sector, in terms of our facilities, is very, very energy intensive and waste producing. But this is not the full climate footprint of care. This is also in some of the hotspots like anesthetic gases or the hydrofluorocarbons and metered dose inhalers, the puffers. It's also in patient travel, so how we organize service delivery. It's also in medicines. Medicines generally are a hotspot of harm, and medical devices. There's other things, of course, as well. But as you can see, the climate impact of care is, you can't just reduce the climate harms of care by making our buildings more efficient. You need to think about services and systems of care, how clients are cared for. So I mentioned that we haven't yet seen a great deal of certainly federal action on the low carbon sustainable health system, but I think we will. I'm hopeful that we will. As Sherilee mentioned, COP26 that happened last fall was particularly elevated health, and the WHO health program, or COP26 health program, sought national commitments to deliver a climate resilient, low carbon, sustainable health system. And after the US signed on, Canada and 43 other countries did. And importantly, given that little chart that I just showed you, the commitment to deliver low carbon health systems includes the supply chain. So this is not just the buildings and the energy, it is the products and services that are purchased in order to deliver care, which is very important if we're to actually drive change. So that's the second answer, I think, to the question, why health systems? First, they must. Second, arguably, there is a moral obligation and certainly a set of opportunities to think about how to reduce the environmental harms of care. There is a third reason, and that bears on the social role, the social status, the social impact of health systems. And it relates, I think, to the fact that the challenges that we're talking about are incredibly complex. We're focusing here on climate, but all of us are fully aware that climate change is not the only ecological challenge that we face. And this image, which is this sort of planetary boundaries image, is an effort to try and conceptualize clearly for us the range of ecological challenges we face, and to suggest that there is an ecological ceiling across, let's say, 9 different sort of domains of our biophysical systems that we must live within. There is an ecological ceiling that in some areas, like climate change, like biodiversity loss, we are exceeding. There is overshoot. So it is more than climate. There are other ecological challenges. It's a more complex problem. And it's not just ecological. It is always and inevitably eco-social. And here is the extension of that previous image with the ecological ceiling, developed by Kate Raworth in an effort to put the social in. So what you see here with this image is both that ecological ceiling and the extent to which there is overshoot in some areas, ecological domains, but there is also a social foundation. And we can see shortfall in what Kate Raworth has defined these 12, she's put in 12 dimensions of social functioning, which many, many people in the world are falling beneath. And so this is the donut or life belt, safe and just space that we need to live in. There is more going on than just climate. There is more going on than just ecological. And it's not just, I would suggest, although I love this image, I think this idea of a life belt, this idea of a donut for the Anthropocene, how we must find a safe and just space to live together. It's not just a sort of a bare minimum and some people who fall below. It is indeed inequality. And we certainly know the best data that we have on inequality is related to income. We have long-standing data. I invite you to go and search the World Inequality Database. You will find images like this for Canada and many, many other countries. So what we see in this image on the left is that how much of the national income is going to the top 1%. So up until the end really of the Second World War, in the first Gilded Age, they took a very large proportion of that, in the sort of 16%. And then there was a period of relative, much flatter kind of income inequality, much more income equality, and then a rising income inequality in the 1980s, which is still in a dangerously inequitable state. And wealth is always even worse. And one way of trying to capture the degree of wealth inequality in the world is this little statistic here. How many wealthy people does it take to have as much wealth as 50% of the population? Well, in 2009, it took 380 people to have as much wealth as the bottom 50%. But by 2018, it only took 26. And of course, what does inequality do? In addition to concentrating power in unjust ways, making a fallacy of democratic processes, social disillusionment, disengagement, established good social science literature on the extent to which inequality diminishes our capacity for collective action and meaningful and safe societies and healthy societies. And of course, COVID has only made that worse. So on the left, a 2021 report from Oxfam, and on the right, a more recent 2022 report from Oxfam. And I'll just flag the lowest right image there. 20 of the richest billionaires are estimated on average to be emitting as much as 8,000 times more carbon than the billion poorest people. So there's lots going on here that is connected. So this takes us back to healthcare, and I'm going to emphasize healthcare in part here because this is a social institution that is built around providing in accordance with need, not ability to pay. This is the way it functions best. It functions extremely poorly, if at all, as a private pay institution. And it is therefore a social institution that really demonstrates our capacity for collective action. It builds in Canada and other countries a sense of collective capacity, a sharing community, as Carolyn Toohey has written. It is the source of potentially, arguably, a significant source of Canadians' sense of themselves as a sharing community, capable of collective action, capable of working together to take on and address the significant social and ecological challenges that we face. And so healthcare's participation then and engagement in these challenges, both to adapt and to mitigate, but then to engage visibly and more broadly in this process, is an important plank of our social efforts to address these challenges. So I want to just turn now, how am I doing for time? Good. Very quickly to the how. I feel that what I'm trying to introduce and what we're trying to introduce today is this whole seminar session. So I don't want to dwell on any of these things in great depth, just to flag all of the various issues that we need to explore together through this whole series, issues of equity, issues of resilience and adaptation, issues of mitigation. But when we think about how to reduce the climate and other environmental harms of care, this is a really lovely model and a conceptual framework. And those of you who are familiar with quality improvement will recognize this driver diagram here on the left. It comes from our colleagues in the UK, the Center for Sustainable Healthcare, and their very nice, simple, but clear conceptualization of what does it mean to deliver care in a way that is environmentally sustainable. And so we reduce carbon without reducing quality. To do so, we reduce activity through prevention, empowerment, or lean pathways, or we reduce the carbon intensity of our activity. That's where low carbon alternatives like low carbon inhalers, lower carbon anesthetic gases, or indeed regional anesthesia and other potentially total intravenous anesthesia and other such efforts and facilities. And here's another conceptualization, a different one developed by Andrea McNeil, again, a colleague from the University of British Columbia and colleagues, and a similar kind of philosophy as to what we're trying to do, but slightly differently conceptualized. What is planetary healthcare? First and foremost, it rests on reducing the demand for health services through addressing the fundamental social determinants of health, health promotion, disease prevention, chronic disease management. When that is resolved, in a sense, as our first step, we think about matching supply to demand. We think about issues of appropriateness. We think about emphasizing primary and community-based care. We think about stewarding our resources very, very carefully. And then we reduce the emissions from the supply of those services we must still, because they are important, provide. And all of this together, both of those models, I think, and the point that I want to make is much of what we are trying to do as we drive towards low carbon sustainable health systems is align the environmental agenda with much of the health reform agenda in healthcare more generally. And that is an agenda of integrated care, connecting the various often siloed parts of our healthcare system with our social care system, with our primary care system, to ensure that things are person-centered, community-based and community-oriented, that they are appropriate, that they foster community strength and well-being, and high touch. I like to use that phrase as well. And with that, I will turn it back to our hosts and stop screen sharing. Thanks.
Thank you so much. That was a wonderful talk, and I really enjoyed listening to that and to Dr. Harper's talk as well. So we're going to do we have a few questions come in that we'd like to ask. So the first one came in for Dr. Harper, and the question is, do we know why early warning systems are ineffective? Is it due to people underestimating the detrimental impact of heat waves, or is it the means of communicating the warnings?
It's a really great question because we actually don't know, and this study was a bit of a shock, but it's a really good example because it highlights a common problem across adaptation strategies. So we think that a lot of these things are working, and we just they're like our go-to thing. You know, like you want to adapt to a warming climate, you do an early warning system. You try to protect health in a certain way, like you do these things. But there's not a lot of research done looking at the evaluation piece of that and how effective are they at actually protecting public health in the context of climate change. So it might have been effective, 10 years ago, but is it still effective today when we're experiencing warmer and warmer weather and more heat waves? That's the question mark. And so if you look at systematic literature reviews that have looked at climate change and health adaptation strategies, what you see is that most of the research looks at how climate change has already impacted health. So very little research is looking at projections looking forward. And even less research looks at adaptation strategies and how effective these different things are at actually protecting public health. So this type of research is only starting to emerge, and we just don't know the answer, and more work really needs to be done on it, and urgently. We have a very small window to start acting on this.
Thanks so much, Dr. Harper, for answering that. We have another question in the Q&A, and I think this might be more for Fiona, or both of you can answer if you want as well. So it seems like there's a lot of awareness and information around climate change, but how do we improve people's understanding of the gravity of the situation and the climate change will and is affecting our lives? How can we further encourage people in leadership positions to take tangible actions to consider the environment in their decision while remaining financially stable?
I'll start if you want. I mean, I think that there is in my dealings with health leaders, there is, growing ambition and interest. And the questions I'm often getting is, what exactly should we do? Tell me what to do. I spoke to a CEO just a couple of hours before this meeting about their new strategic planning process, a hospital CEO, and how to move the agenda forward. So I don't want to be Pollyanna-ish about it, but I do think that the message is being received. The message has been received. Trainees, it's very, very motivating to health leaders to know that medical students, nursing students, pharmacy students are passionate and insistent that this be part of their education, this be part of their practice. This is motivating to leaders. Many of them have children themselves who've walked into their office and said, Mom, Dad, what are you doing on this? So I do think we're at a, it's always the best of times and the worst of times. I think we do actually have a real opportunity to bring together some of the knowledge that exists around the world to from a Cascades perspective, there's a lot of research needs, but there's also a lot of quality improvement opportunities, and there's opportunities to develop more strategic, more ambitious plans on the basis of what we already do know. So I think that we are, and I'm really delighted that the federal government the government of Canada has acknowledged that the health sector has a role to play in Canada's transition to a low carbon economy, not just from adaptation, which has been clear for a long time, but in terms of really engaging in a low carbon transition. So I think keep pushing and let's work together to offer more actionable kind of messages and strategies for change while we do more research, because it is going to be a stepwise progression to figure out some of the answers to these questions.
Dr. Harper, do you want to comment on that too?
I'm sure. I guess just to say that I completely agree. I mean, I think, I honestly think that things are changing really fast. I mean, like 10 years ago when I was doing climate change and health research, it was doing research in places like the Arctic or in Africa or the Amazon that were seeing some of these like early signs of climate change, and no one else was really talking about it, or this idea that climate change could impact us now was something that people didn't really see. But I would say in the past 3 or 4 years that's totally changed. And I think one of the main reasons it's changed is because of youth and what's happened with the protests and bringing attention to the issue, making it an election issue from municipal levels all the way up to the federal level. And then not just making it an election issue, but making it an everyday issue and holding decision makers accountable for it. And at COP26, maybe I'll share my screen really quickly to show you a couple of pictures from it. Oh, here we go. So at these COPs, there's also a lot of like civil like protests and things that happen outside of the negotiations. And there were a ton of health related protests, which was really cool, which you can see in these pictures. And I think that these types of things actually matter. And when decision makers were walking to the negotiation venue every single day, they literally walked past thousands of people who were protesting for more climate change action. And a huge amount of them had something to do with health. So I think that it's this type of thing that's actually making a difference and moving things forward. That, in addition to obviously seeing more and more impacts every year.
Perfect. So in terms of this question, I think this is something that both of you could comment on as well. So the question says, have we come across any data on the positive environmental impact from stay-at-home measures during the initial COVID lockdowns? Is it possible for a quick shift to reduce climate change if required, or would it take a longer time period for measures to start working?
Fiona, you might have a lot to say on this, but I can say that, like, while initially we did see a dip in emissions and everyone was really optimistic that maybe some of that could be sustained, we quickly saw that it was like a drop in the bucket and made no difference or no impact at all, and wouldn't even be enough. But I think that what this gets at is that it's as individuals we need to do lots, we need to do more, but we will not be able to turn things around or develop or build a climate resilient future unless we work together. It has to be systemic. Individuals traveling less or staying at home and driving less isn't going to do what we need to do in terms of emissions. It's a much bigger systemic issue that we have to address together. And I think that Fiona's presentation did a really nice job of that in showing how, like, the entire sector needs to change to be able to see the impacts that we need to see.
I mean, I'll only add to that I do think, lockdowns have also negative impacts, right, on people. And actually, I had a great talk recently about from Anthony Gerber, who talked about some of these challenges that you've been talking about, Sherilee, in terms of early warning and how to deal with the disbenefits of telling a person to not go outside when if it's one day, but if it's a week or if it's 2 weeks, and they're an elderly person or a young person, what's happening to the rest of their health. And so we are going to have to, I'm not a fan of catastrophism, and I'm not a fan of crisis planning, because we often don't have it right. We do also do harm while we try and do well. So clearly we need a lot of engagement with individuals and communities, a lot of sort of, I don't mean to not act, but obviously some strong action is required, but we do have to recognize the disbenefits of some of the interventions that we might pursue.
All right, thank you both so much for your answers to all these questions. I think we're going to wrap it up since we're approaching 8 o'clock. But again, we want to thank you both, Dr. Harper and Dr. Miller, for your great presentations. And thank you to everyone who attended and asked questions. In terms of the certificate, we're going to send out information about that more towards the end of the session, but it'll be a very broad kind of open-ended reflection for you to just discuss either something you enjoyed learning about, how this might change the way you practice in your healthcare profession. And we'll send out a form for you to submit that at the end of the series. So yeah, more information to come soon. Thank you all so much for attending and hope to see you again at the next sessions.
And our next session is March 23rd at 7 p.m. It's Wednesday. So we have some great speakers who are coming to that session. So we're really excited about that as well. So thank you everyone so much.